Dear friends, today we will see another new drug information. Metrileptin is a very interesting drug. Metrileptin is a recombinant human leptin analog for injection that binds to and activates the leptin receptor. We all know that leptin is a natural hormone secreted by the adipose tissue which regulates appetite and food intake. A reduction in leptin level leads to increased appetite and increased food intake, as well as increased leptin leads to decreased appetite and food intake. Metrileptin is a leptin analog. It is mainly indicated as an adjunct to diet as replacement therapy to treat the complications of leptin deficiency in patients with congenital or acquired generalized lipodystrophy. In generalized lipodystrophy, there is leptin deficiency. Metrileptin is a recombinant human leptin analog for injection that binds to and activates the leptin receptor. Adipocytes store lipids to meet the fuel requirements of non-adipose tissues during fasting. In patients with generalized lipodystrophy, the deficiency of adipose tissue leads to hypertriglyceridemia because triglycerides may not be taken into adipocytes, and there is ectopic fat deposition in non-adipose tissues such as liver and muscle. So when there is ectopic deposition of fat in liver and muscle, that may lead to insulin resistance and worsening of diabetes mellitus. All can happen. Native leptin is a hormone predominantly secreted by adipose tissue that informs the central nervous system of the status of energy stores in the body. That means native leptin, will decrease the appetite and decrease food intake. So whenever there is deficiency of leptin, that causes increased food intake and increased appetite. That may worsen the insulin resistance. In patients with generalized lipodystrophy, leptin deficiency resulting from the loss of adipose tissue contributes to excess calorie intake, which exacerbates the metabolic abnormalities. Metrileptin exerts its function by binding to and activating the human leptin receptor, which belongs to the cytokine family of receptors that signals through JAK-STAT transduction pathway. This diagram depicts before and after treatment with metrileptin. You can see the drastic difference in or improvement in lipodystrophy after metrileptin therapy. So this is a new drug, metrileptin injection, a new human leptin receptor analog for the management of congenital or acquired lipodystrophy. Thank you.